So I was on the phone this morning with a pharmacist from Belmar Pharmacy, and they had a venture with MedQuest, which is one of the advanced bioidentical hormone therapy providers that we use for their purity, potency, and price point that I really love so much. Anyways, this pharmacist was telling me about new products that they have when it comes to peptide therapies, which we haven't really talked about much here yet in the Kalon West space, but yes, we do use some peptide therapies. Now that's a big topic, and so we're going to address that later, but I wanted to tell you about this product in general because it's something that I don't think is well known about when it comes to scalp, excuse me, point of face, because there's facial, they have a facial product, and scalp therapies. Want to hone in on though the scalp formulary, because most people, if they have some type of hair thinning, hair loss, whether it's due to pregnancy, trauma, stress, postpartum, pregnancy, hair loss, or COVID, or autoimmune diseases, traditional medicine will kind of put you on some things like minoxidil, or they'll recommend you go to Ulta and grab like a hair scalp serum from Divi or something, and those things might work truly. But this product, I think, is it's been around for a minute. I've used it on clients, but I didn't know I had access to it in a compounding pharmacy way, and it really has worked for both men and women respectively. I thought I'd just share it real quick and briefly because maybe you're somebody who's tried 3, 4, 5 things and nothing's quite worked, or maybe you've tried 1 or 2 things, got a little bit of potency out of it, but you're ready for the next thing. Here's another option, just ready and available for use. Yes, you do need to go through a compounding pharmacy for this. This is not something that will exist at Target, CVS, or Walgreens. Yes, you do need a prescription for it, so come see us, we'll get it in your wheelhouse for you. But why I like this product, it is created in what we call a tricosol base. And what does that mean? A tricosol solution, it is water-based with plant minerals, okay? So ladies and men, it won't get crunchy, it won't get oily, it won't ruin your hairdo, hairstyle, or treatment planning for the day. You don't have to wash it out right away. You don't have to sleep in it overnight, right? Those are all the things that we kind of hate about topical solutions. So we eliminate a lot of those problems with this base that's called tricosol. And I have some notes in front of me, that's why I'm looking down here, just because I want to make sure I stay on track and give you the right information. Anyway, so tricosol base, and what you do is you drop this product. So what's in the product? I should start with that. This product contains several things. Now, one of its most simplest forms is just GHKCU. What is that? It's a peptide. It's a peptide therapy. Well, what's a peptide? Without going into the whole enchilada of that debacle and debate and all the latest press news, a peptide, simply said, is a bunch of amino acids stacked in a sequence that then, when placed in the body, codes for a certain function that often does repair work, restoration, and healing. So for example, collagen is a peptide. We give ourselves collagen. You can go to Whole Foods and buy a whole big bottle of it. You put it in like a smoothie, a shake, a powder kind of drink. And collagen, when it's ingested into your body, will code for building a strong hair, skin, and nails, for example, okay? So you put it in the body for the purpose of promoting a function that has an outcome desired within your system. So it's not necessarily a nutraceutical where you like grabbed it off the tree, ate the purple root or the plum or pear, right? But it's not totally pharmaceutical in the sense that it was derived in a lab and we have no, your body has no prior known existence of how to use it. Your body's already familiar, for the most part, with this entity. So it's a little something of a hybrid in between, is what I like to tell people. So GHKCU, excuse me, is a peptide, as collagen is a peptide, and its function is kind of interesting. One of the things that GHKU is relevant for is it's able to promote wound healing, interestingly enough, hair restoration, which is why we're talking about it, and skin repair, which is really fascinating. So GHKU in a topical solution at the root of your follicle will promote a very bioavailable follicle collagen stimulation production, is the best way to say that, which will promote hair regrowth after loss or thinning. And so I really like this product because I have used it with both males and females respectively, and I have seen hair regrowth when other things did not formally work, or this just worked better than what they were previously using. Now, most people will use 2 droppers throughout their scalp for the first 30 days, and then you can graduate onto 1 drop for the next 2 months. You can use it ongoing, but if you've grown the hair that you need to, you can also stop and then you can restock accordingly for whenever you might need it next, if you need it next, or that might just be all that you needed. So GHKCU, the peptide, in a Tricasol solution, it can be really fabulous and very potent when it comes to hair regrowth if you've had hair thinning or loss. What you can also do though, and what you can also make in a Tricasol solution like that, is you can put the GHKCU in it, but other pharmacies also use topical progesterone, and they'll use topical sirolimus in concentration with the GHKCU to deliver a different package of therapy to you, but for the purpose, again, of hair restoration and growth. So why would you add in the progesterone and the sirolimus? Good question. We'll talk just briefly about that. One of the main advantages of progesterone is that it acts as a naturally occurring 5-alpha reductase. Well, what is 5-alpha reductase, Richelle, and why does that apply to me and my hair? Good question. When you convert testosterone into something called DHT, and DHT is the active form of testosterone, it gives you all the benefits that you think of, like libido, muscle mass retention, energy. But on the negative end of it, it can also cause some hair thinning and the follicle of your hair to shrink. So a way to stop that side effect from happening is to target the enzyme that converts testosterone to DHT, and that's called 5-alpha reductase, the little person in the middle of the thing. So progesterone acts as a 5-alpha reductase inhibitor, meaning it essentially stops that little person enzyme from doing the testosterone into DHT so aggressively, so that you won't have as much of the hair thinning impact when it's applied topically to you. Interestingly, topical progesterone is very similar to what you might be prescribed by your primary care or someone else, traditional medical model, called finasteride or dutasteride. Essentially, they work pretty much the same. So just FYI. And then the third member of this family, when it comes to the combination hair scalp serum that you can use, is called sirolimus. Now, this is a repurposed pharmaceutical at high doses. You might have heard of it, called rapamycin. It is used to suppress the immune system in patients who might have had like a kidney transplant for example, and you want to suppress the immune system so it doesn't reject that kidney that was just donated to you, right? However, at low doses, it behaves differently and uniquely and doesn't have all the side effects as the high doses might, and you might see. So sirolimus, when used in a topical scalp hair serum solution, it promotes cellular detoxification. It actually has the ability to decrease inflammation largely around that root and the follicle, and it has the potential to really reverse or halt graying. Kind of interesting, and definitely worth it. So whether you're male or female and you're kind of stepping into this wheelhouse, or you've tried almost everything under the sun when it comes to hair thinning or hair loss, just from genetics, from age, maybe from cancer treatment, or postpartum or COVID or thyroid disease, vitamin A toxicity, etc. We can try this topical solution on you. Caveat, if you are someone who has a history of cancer or is undergoing active cancer treatment, this would not be for you. If you had a prior history of cancer, we would want to work with your oncologist to make sure that it's safe and that they would promote this, because GHKCU can have some cellular replication properties that would advance the growth of things. And so we just want to make sure that even though it's in topical solution and likely will not get absorbed systemically, we would just want to be safe across all boards. So anyways, if you're interested in something new that's not Adulta, that you haven't tried from your PCP, and that sounds like, might work, might give me that new hairdo, then come see us. We'd love to work with you on it and see if it's the right fit for you and your luscious locks moving forward. Anyways, GHKCU, progesterone, and sirolimus in combination, or just GHKCU as a topical solution, they have some promise. It has some promise in helping to restore your hair growth and make a better, fuller head of hair for you.